Hi, I am Nur and I'm going to present to you about physical fitness training among stroke patients. Let's go. Okay, first of all, why does stroke patient need to do physical fitness training? First, because majority of stroke patients may further inactive physical lifestyle. So, the lack of physical activity may trigger them to have poor cardiovascular fitness, increase the risk of cardiovascular disease, deterioration of physical functioning, and reduce quality of life. So, this training has important role in improving cardiovascular fitness and other health outcomes. Okay, next we proceed to the outcome of this training that give benefit for stroke patient. Okay, first of all, the primary outcome of this training is to improve the effectiveness of the autopic, which means we want to target an optimal amount of oxygen consumption of an individual during the exercise. Okay, next, the secondary outcome of this training is to improve cognitive function, cardiovascular health, and functional performance like walking speed, balance, and endurance. Okay, before we start our physical fitness training, it is necessary for us to screening the patient first, so we can reduce any adverse event during the exercise. Okay, the aim of this screening is to exclude any patient from the screening, identify the person in high risk, and identify the person who needs special cares. This screening tool is an example to identify those individuals who may be at higher risk of an adverse event during exercise. Patients who pass this screening may proceed to undertake light to moderate intensity exercise. Other than that, we also must take these two things keep in concern. They are dyspnea rate and perceived exertion rate. These two things can be measured using box scale. Box scale also can be used as a method to monitor intensity. Wait. Before we start our training, first we must make sure that we wear sport attire. And second, we must do stretching. Let's go. For stretching, we must stretch at least for 15 seconds. Stretching can reduce the risk of injuries and also improve performance in physical activities. Okay, now we can start. Okay. In a study by Park et al. 2013, there were two most popular modalities that provide aerobic training for stroke patients. They are treadmill and cycle ergometer. This is the example of treadmill. We switch on the treadmill to start the training. For safety, we start from low intensity. Then, can increase the intensity to moderate intensity. We must increase the intensity until we achieve the target heart rate and make sure to maintain for 10 to 20 minutes. Make sure physiotherapists give fully attention to patients. Next is cycle ergometer. Cycle ergometer gives benefits when patients have poor standing balance, so it may be a good option as it requires less postural control. It also uses the same concept which physiotherapists must give fully attention, especially for the first time attempt this fitness training. Demonstrate first until patient understand and make sure patient in comfortable condition. For the beginners, use low intensity first, then progress to moderate to high intensity. Using cycle ergometer, we also must achieve the target heart rate and also maintain for 10 to 20 minutes. For exercise prescription, we do FITT concept. Frequency is 3 to 5 days per week. For intensity, the initial target heart rate is 40 to 50% of maximum heart rate. For an example, Mr. X is 45 years old. The target heart rate is 40% times maximum heart rate. The maximum heart rate is 175 beats per minute. So the target heart rate is 70 beats per minute. This is the initial target heart rate that we must achieve. For the progression of target heart rate, we can achieve from 60% until 80% of maximum heart rate. Next is time. We can do from 20 minutes to 40 minutes per session. For the initial training, we can do short exercise with rest period in between. For endurance, we can do for long period with shorter rest period. Lastly, for the type exercise, we have the option to choose whether cycling, as it's safer to patients who have poor standing balance, or treadmill. When patient is discharged from hospital, patient can continue at home. If they don't have cycle or treadmill, they can marching on the spot, repeated sit to stand, and also step up. For the progression of marching, we can increase the number and speed of the repetition. For sit to stand, we can lower the chair. And lastly, step up, we can raise the step height. This is the example of repeated sit to stand. Make sure the chair is placed against a wall to prevent it from moving. Patient is seated in the middle of the chair with correct posture and arm crossed over the chest. Then, step up exercise. Patient need to stand up straight and they allowed to hold onto a wall. Okay, we have reached to the end of this video. I hope you get something and benefit from my video. And thank you for watching. Bye.